Quynh-Thi Nguyen, and I will be presenting on the encyclical Why the Concept of Death is Valid as a Definition of Brain Death. Brain death is the irreversible damage to the brain in which the functioning organs are maintained by artificial means, which means that the individual is dead. The brain is the receiving center of all sensory, cognitive, and emotional experiences that acts as a central force of existence. The integration of the senses, the body, and the intellect's activities all come from the power of the brain that directs and controls everything. Thus, if the brain doesn't have this unity within the body, then the individual soul and life of the person disappears. According to both St. Augustine and Pope John Paul II, death is a separation of the soul from the body. Therefore, when the brain is damaged and fails to function, the soul no longer is within the body. The soul is forma corporis, meaning that between the soul and the rest of the body, the soul acts as a sort of as a motor that drives the body into operation or function. Brain death does not signify death. It is not equal to death. It is not a synonym for death, but it is death. It is difficult for people to accept that a body with a functioning heart and pulse is dead because they can't see the dead brain matter for themselves. In addition, the ventilator sort of acts as a camouflage, as it artificially maintains the appearance of the body and its function. No matter how long the body's organs are functioning, when brain death has been properly declared, no conscious activity will ever occur again. A neurological examination that includes an evaluation of consciousness, reflexes, and blood movement in the brain is used to determine the declaration of brain death. A majority of brain-dead bodies will suffer multi-organ failure despite efforts to preserve the body's organs after the original injury to the brain. Brain death is distinguished from other brain dysfunctions. Brain death has certain criteria to be met in order to cross the line between life and death. In addition, there is no need for every single cell in the brain to be dead for it to be confirmed. Although there are recoveries from other neurological injuries like comas or patients in vegetative states, there is no chance of recovery from brain death, and that fact must be distinguished. A patient in a vegetative state compared to brain death is unlikely to die due to the function of the brainstem, and it is easier to maintain the organs of a vegetative patient compared to a brain death patient. Claims of the chance of awakenings from brain death have been used to discredit the concept and prolong artificial medical support in hopes of a recovery. Based on clinical data, in a study, the accuracy of brain death diagnosis was 100%, and further demonstrates that brain dead is dead. Several papers demonstrate that keeping organs functioning after brain death is also quite difficult and fails within a few days. Some argue that brain death is accepted quickly in order for organs to be used for donations. However, this is false because that would be considered murder if the patient were not actually dead. Claims that the information by neurologists were misinterpreted were also used as arguments against the concept. However, through tests such as the apnea test, we know that the tests are meticulous and are accurate. The criteria for brain death was developed around 40 years ago and continues to broaden today. Thus, the world continues to learn more about brain death and the grounds on which they can declare a person dead. From a majority of neurologists across the world, brain death is death, and that is a fact. Many still object to this due to the denial of accepting that the person is dead. Many have a persistence and hope that the individual will come alive again. However, the body is only functioning through artificial means and the person is dead. Many find this difficult to accept and want to postpone the pain for as long as they can. Lastly, we see that the soul makes the body come alive to function. Thus, if the brain is the main force of the body, if it were to stop functioning, the soul would leave, which means that the person is dead. We recognize that the soul has the most important purpose in our lives, as it is the function of our body. Thank you for listening to my presentation.